I was reading a book, and I must have fell asleep reading the book because I remember waking up and the book was right there. And I remember waking up at 5, and I realized that he wasn't there. So I got up and I walked in the living room thinking, maybe he slept on the couch. And he wasn't there, so I started calling. And no answer, and I'm just calling and calling and calling. And then finally he answered.
So I answered the phone, and, we talked. I was like, I'm coming, I'm on the way home. She was like, all right.
911, what's your emergency?
It's just a wreck on Blanchard Road by the Daco Machine Company. It's a van wreck.
Okay, do you know what type of vehicles are involved?
A Cadillac CTS, and there's somebody stuck in the car.
She's trapped in the car?
Yeah, I think it's the whole car is mashed in. Yes, ma'am.
Okay, we have them on the way, so they should be there in a few minutes.
Okay.
All right, thank you for calling.
It was like this voice in my ear that said, get your keys and go. And right when I got to the North Lakeshore underpass, I got out and I started walking, and then finally I see the Cadillac symbol.
I think it came in about 5:50, somewhere around there. It's close to 6 o'clock in the morning. It looked pretty bad. He was trapped inside the vehicle.
And I'm screaming like, that's my husband. And so in my mind, you look at the car, you think, okay, he's gone. So I'm screaming and I'm hollering. I'm in the middle of the road, and I'm hearing somebody say he's gone. And it's just like, no, you can't see him like this. No, we can't let you see him like this.
His legs were still trapped and pinned under the dashboard, so we really couldn't get a good feel for what we had going on down in his lower extremities. I remember him having a big gash in his chin.
I'm screaming and I'm hollering, fight, Ray, I need you to fight. I need you to fight. Just keep fighting. And the next thing I remember is somebody hollering saying, he's not gone, he's still with us.
First things first, we could see that the dash was rolled down on his legs, and the car, the driver's side door was pretty much pushed in up against his left side, and he was pretty much rotated on his right hip, and his head was facing the passenger.
There's like blood coming out of his ears, his nose, his eyes. And the first officer, he comes and he tells them, take her away. It's just, the image.
We actually had to cut away the door, peel away the door. And when we peeled away the door, we realized our job, usually that's just something as simple as that, just to get the patient out. With him, that wasn't the case. The actual firewall and the engine compartment was laying on top of him.
So our biggest deal was time and saving tissue, saving muscle, getting him to the hospital where he can receive blood or whatever he needed.
We go from rescue mode to EMS mode. So literally, as soon as I said, hey, he's free, let's get him out, start IVs, get him in the back of the truck, and get off scene as quickly as possible.
I gotta get in touch with my mother-in-law. I have to. I kept calling.
The phone rang. My husband answered the phone.
And I tell him, Ray's been in a wreck. You okay, right? And I'm like, no, he's not. He's not okay.
And I'm like, Lord, my child in a wreck. Lord, what's going on? What done happened?
Our pages clearly stated it's a tier 1 activation. That's the highest level of activation in terms of the seriousness of the injury. Once we got that pager, the whole team went down to the trauma bay.
We want the patient to have the best care possible, and LSU is a level 1 trauma center, and so that means they have the people on staff 24 hours a day, so that is the best place to take any major trauma in this area.
When the ambulance crew moved him from the stretcher to the bed, we examined him. We have a method to examine a patient. We call it ABCs. We looked at his airway, we looked at his breath sounds, but we didn't feel any pulse.
They got him to the hospital and ended up having to, I believe they had to end up cracking his chest and bringing him back because he coded there.
At that moment, we decided to open his left chest in order to block the blood supply which is going to the abdomen, because we knew that he's bleeding into the abdomen.
It was touch and go. It was very rough. We lost him. And he told us that he had to make a judgment call. He could have either called a time of death, but he decided to crack his chest and massage his heart. And they got a pulse.
So once we opened the chest on the left side, we saw there was about 300 cc's of blood in the left chest cavity. Once we put the clamp around the aorta, we rolled him to the operating room. Every minute is important in this scenario.
I could have jumped up and hugged him because I feel like that judgment call made all the difference.
This was life and death. Losing pulse in the trauma bay in front of us is the highest level of injury he could have gone through.
The most immediate concern for me was his continued cardiac instability.
Dr. Owens grabbed my hand, and as we were running back to the SICU, he said, "I need you to talk to your baby. He's trying to go the other way." And we all was running down there, and I told him, I looked at him. I say, "Ray," I say, "this mama." I said, "Come on back this way. I love you so much. Don't do this." His blood pressure started rising. His pulse ox, everything started coming back. And Dr. Owens, he nudged me like, "Keep going, keep talking to him, keep talking to him."
We were able to get him back from that, so I focused my attention on continuing the resuscitation and addressing the byproducts of having been so severely volume depleted. That's why he had a cardiac arrest in the emergency room, is because he essentially bled to death.
I paced. I probably burned a hole in the floor because I paced back and forth, back and forth, back and forth. We tried to sleep. We put some tables together, but we couldn't. So we just kind of sat up and we just talked to each other.
When you do something like that, and it is 7.5 hours, the irony is that it seems like it was 30 minutes.
The family was very, very positive in the fact, thinking he's going to get better. And he was the same way. He knew he had a lot to live for.
He had 3 cardiac arrests. The likelihood of him surviving was on the order at that point of probably about 1 or 2%.
He lost the kidney. He lost the spleen. He just gave us the rundown of everything, told us that from this part of his face down, detached. He wasn't strong enough to go through surgery to fix his face, and his leg, his bone actually penetrated, it came out.
He had chest tubes. He had, tubes coming because of lung issues, a ventilator.
He needed to have a femur fixed, I believe, and during that time, he became tremendously unstable to the point where he was as unstable as he was when he first came in.
The first time I saw him, when I came back the next time, which I was off several days, I didn't know if he'd be there, and he was there. And that says a lot. And there were several times I'd be off and come back, and you'd know, say, "Oh, he coded again." We got him back.
We still had a couple more episodes where his heart slowed down, and we had to give him epinephrine to get him back again.
We walked in and the nurse said, "I still can't get him to respond." And his mom walked up and said, "Now, Ray, I just done had enough. You're going to have to get up out this bed." And his eye opened.
I happened to look around. I was like, man, what's going on,
But they moved him up to the 8th floor, and he had started getting therapy. And then he had started conversating with us and talking. We had, when I heard his voice for the first time.
It was interesting. She gave him the voice box for the trach, and she said, I need you to, she told him to cough. And his cough was really, really weak. And she said, well, sometimes, they can't talk right away. And she was like, can you just say hello? Say hello for me. And next thing I know, I heard,
hello? Something like that. I think it was like, hello?
I just shouted, thank you, Lord. Thank you.
And he went from hello to I love you, and then 1, 2, 3. And he's been talking ever since.
I can't say I was scared because I prayed so much. Like, when I was down, I prayed so much, because honestly, I knew at that time that was all I had.
What I kind of always tell my patients is that it'll be a one day at a time. It'll be like a slow healing process.
I had my little walker, and they was helping me walk. So I did a good little walk, and they was like, you're doing good, How you gonna be discharged today? And I was like, okay, I'm ready. I had to go to physical therapy after they discharged me. So I was like, I'm ready. I'm gonna be running.
He was back to normal to me because he was. I'm not gonna be here long. We're gonna go ahead and do this, and we're gonna get out of here, and I'm gonna start working out and lifting weights. I say, now that's my Ray. That's my Ray there.
I came out of physical therapy a day before Thanksgiving. I went back to work February.
I feel they went above and beyond their call of duty when it came to his care and his treatment, because it was beyond nursing for them. They treated him as if that was their family.
It was just a miracle from God, because if some of the people hadn't been in place the way they were in place, he wouldn't be here today.
I'm not a hugger, but I would have to hug each and every one of them and tell them that everything that they did is greatly appreciated.
Thank you. Just thank you.
When I'm allowed to participate and be part of a symphony that has such sweet music, that we have a miracle like Mr. Snow, it's why I went into trauma.
Now I take nothing for granted.
I'm just more about my family now, and satisfying, making sure my wife is good, because, happy wife, happy life.
When he was going home, he came to the ICU, kind of what I call it, like to say hello or a victory lap. And he came, and his mom was with him, and the ICU crew informed me that they are here to say hello to me. And I had it was very emotional to see him, a young patient who has survived such a big ordeal, and it was amazing. I don't think so I have words to describe it.
Most patients that receive that kind of trauma need a surgeon. They need an OR quickly. And LSU is the only facility in this area that has properly trained staff 24 hours, 7 days a week, 365 days a year.
It's so important to have a level 1 trauma center here because of the need and the care we provide.
We're able to do anything that any other level 1 trauma center can do, and do it extremely well. And we're also growing. We're growing both in our patient volume and the number of trauma surgeons.
The staff as a whole is amazing. And I just think everybody should know that, because they don't get enough credit.
LSU is all I know. Don't take me nowhere else. I want to go to LSU. If anything happens, if LSU can't fix it, nobody can.